Hello, everybody. My name is Kyle Koga, and my research project was on lessening the negative effects that exercise has on tooth decay rates and dental caries in an athlete's mouth. At the beginning of the year, I was very intrigued to do a project relating to cavities and the oral environment. Cavities, also known as dental caries, are considered the most chronic disease among 6 to 19-year-olds in America. According to statistics, dental caries are 4 to 5 times more common than asthma in children and adolescents. Economically, dental caries is the most significant global oral health burden, and various countries spend enormous amounts of money every year on expenses regarding this problem. As I was reading different research papers about tooth decay in young adults, I came across a paper that talked about how exercise can cause your mouth environment to be more susceptible to tooth decay and developing dental caries. It stated, a high proportion of physically active young adults have erosive lesions, indicating that hard exercise and decreased stimulated salivary flow rate may be associated with dental wear. In other words, when you exercise, the amount of saliva you produce decreases due to rapid breathing, sweating, and dehydration. This decrease in saliva makes it difficult to clear and neutralize dietary acids in the mouth environment, which can break down tooth enamel, which is around your tooth, and make it easier for a cavity to form. Knowing that exercise can cause an unhealthy mouth environment, I decided to focus my experiment on athletes in particular, and how these negative effects can be prevented. That's when I discovered xylitol, a white crystalline carbohydrate that was discovered around a century ago. It's found naturally in fruits, vegetables, and berries, but can be artificially manufactured from xylene-rich plant materials such as birch and beechwood. One of its common uses is to act as a sugar-free substitute, found in many gums like Spry or the actual xylitol brand. It was found that the effect of xylitol prevents dental caries dependent on dose and frequency, but reductions of cariogenic bacteria, the bacteria that causes dental caries, can be achieved through high doses. When used as a chewing gum, xylitol can increase the salivary flow rate inside the mouth, promoting mineralization and the protection of this tooth enamel, which could perfectly combat the problem of decreased salivary flow rate in athletes. In a past experiment, 10 grams of xylitol consumption per day showed a caries preventive effect when chewed 3 times per day or more. So this led me to my research question. Can chewing xylitol gum reduce the increased rate of tooth decay and dental caries in an athlete's mouth environment? And I hypothesized, if athletes chew 2 grams of xylitol gum 5 times a day, so 10 grams total, they will reduce the negative effects that exercise has on tooth decay rates in their oral environment and be less susceptible to dental cavities than if they weren't to chew the gum. So my experiment consisted of 10 varsity basketball athletes who followed a similar exercise regimen throughout the time of the experiment. The 10 athletes were split into 2 groups, group 1 and group 2, as you can see on the diagram. During week 1, group 1 was tasked to chew 5 2-gram Spry xylitol gum packs a day, so 10 grams total throughout the day. At the same time, group 2 was asked to keep their same regular dental hygiene routine in order to keep statistics accurate. During week 2, the 2 groups switched, and now group 2 would be chewing the xylitol gum, and group 1 would keep their normal dental hygiene routine. The means of measure of this experiment was the carie-free carie susceptibility test, which is a 1-minute chairside bacterial test to assess patients' risk for developing dental caries. The way the test works is that I would take a sample swab of plaque from the inside of the participant's bottom row of teeth, and the swab would then be put into a machine, and the oral bacteria load, or whatever bacteria they find, would be assessed. The machine then outputs a score between 0 and 9,999. The higher the number, meaning the more susceptible the subject is to developing a dental carie. So the way my experiment worked was that I swabbed all participants at the start of week 1 to get a baseline score for each participant. I then swabbed all participants again after week 1, seeing if there was any clear difference between the numbers or the scores of gum chewers and non-gum chewers. My last swab was after week 2, where I again looked for differences in data that could help support my hypothesis. It's important to note that the control variable of this experiment was the participant's own swab evaluation score at the start of the week they were tasked to chew the gum. Now moving on to the results of my experiment. Data show that in group 1, there's an average difference of positive 1,434.5 in no gum results and an average decrease of 671.38 in gum results. This means that in the week that group 1 did not chew the gum, their susceptibility score had an average increase about 1,500, meaning their mouths became more susceptible to developing dental caries. But in the week that group 1 did chew the gum, their scores had an average decrease of around 700, meaning that their mouths became less susceptible to dental caries. This data was good because it supported my hypothesis. Now in group 2, there was an average difference of 2,005.25 in no gum results, and an average difference of positive 20.25 in gum results. This data followed the same trend as group 1. In the week where participants were tasked to chew no gum, there was an average score increase of around 2,000, meaning that the mouth environments became more susceptible to getting a cavity. However, when they were tasked to chew gum, there was again another increase in score, unlike the last group, but a significantly lower increase than the week that there was no gum chewing that took place. So this can also be concluded that even group 2 supported my hypothesis to some extent. And this is a graph of all my 10 varsity basketball athletes combined. As you can see, there was an average difference of negative 325.5 or 0.6 in gum results, and there's an average difference of positive 1,719.9 for no gum results. This data shows a clear difference between weeks where groups chewed gum and did not chew gum. And again, the combined participants' data supported my hypothesis. It's important to note that my data has a rather large standard deviation, as you can see on the graph. However, in most cases, that's seen as possible inaccurate data. But however, in my experiment, all the participants' mouth environments are different, which is why the scores from the test vary so much. What I more so wanted to focus on was the difference in scores from before the xylitol gum to after the xylitol gum to show the actual effect that the gum had on scores. My data was statistically significant through students' t-tests where p-values were less than 0.05, as you can see from the bottom of the picture on the screen, meaning I could reject the null hypothesis. So this means I could say the xylitol gum was shown to help prevent a more susceptible mouth environment to tooth decay for these varsity athletes in my experiment. And in conclusion, chewing 2 grams of xylitol gum 5 times a day, so 10 grams total, was shown to decrease the susceptibility score of the carie-free caries test, which means it lowers the risk of developing dental caries for athletes. Now, there were some possible errors that could have happened in my experiment. For example, there could have been mistakes in swabbing if the swab didn't pick up enough plaque or enough bacteria, or if participants didn't chew the xylitol gum as instructed throughout the course of the week. Now, for future research, there's a lot of possible future research that can be done to build off this experiment, like testing how long the effects of xylitol last after the gum was chewed. Or could the time of chewing the gum relative to the time of the swab affect the score given through the susceptibility test? Another thing to consider is having the same experiment, but with more controlled variables like toothpaste, floss, mouthwash, or diet. Lastly, I want to figure out how the intensity of the workout can affect the salivary flow rate in people's mouths, and how that can ultimately lead to a more susceptible oral environment to tooth decay. So what I learned from this experiment, I learned that anytime you exercise and the saliva production rates in your mouth drops, you can use xylitol gum to combat this issue, producing more saliva to give you a healthier mouth environment. You can get xylitol gum, and it's easily accessible. You can even run down to Long's right now and get a pack. But I suggest staying away from the spry cinnamon flavor because it has a very strong cinnamon taste. So some advice I would give to future research students is to always try to make deadlines in class because it'll help you stay on task and give you lots of time to put your best work forward. Also, never take advantage of the 2% late penalty every day, because if you wait too long, the grade can really add up and penalize you. Thank you to everyone who made my experiment possible. Dr. Chan and Ms. Kobayashi for guiding me and keeping me on track. My dad, Keith Koga DDS, for donating the carie-free caries test. And Dr. Kim Kuch and the carie-free team for kindly donating swabs that I could use. and then all my experiment participants who chewed the gum. And this is my references. And then, yeah, thank you.